Okay guys, welcome back. So clinical presentations of vesiculobullous lesions, they have no specific pattern. They have ulcers or erosions with irregular margins and epithelial or mucosal tag. Okay, these are actually the roof of the bullous that had been ruptured, and they moved to the peripheral of the ulcers region. So let's start with the first vesiculobullous lesions, lesions of the oral cavity, which is pemphigus. Okay, there are numbers of pemphigus, but the common one is Pemphigus vulgaris. Okay, Pemphigus vegetans are very, very rare. Okay, and this pemphigus is usually in Asians and Ashkenazi Jews, and 50% affect the oral cavity first. Skin lesions will appear following 6 to 12 months. So you may be the first person who noticed these lesions before the dermatology. Okay, dermatologist, I mean. Okay. Clinically, it's presented as a shallow, persistent ulcers, okay, with rugged margins or irregular margins, okay, or epithelial tags at the periphery. And the bulla usually flaccid, but break down quickly to form ulcers. Okay, this is very important, because when you see the patients without the bullous intact, you might think of the pemphigus, not pemphigoid or other lesions. Most of them without bullous or vesicles. You see only the ulcers, might be pemphigus, right? So I will tell you why. Okay, so the site commonly involve the buccal mucosa, palate, gingival, and spread on the floor of the mouth. Histologically, suprabasal cleft. Okay, supra mean above, upper. Okay, and acantholysis. Acantholysis means the cells are separating from the others. Okay, because why? The desmosome has been attacked or destroyed. And single row of tombstone, partunisan at the basal cells, I'll show you. And inflammatory cells infiltrations. IF is immunofluorescent. Okay, showed that immunoglobulin G bound intercellularly in precursor layer and spotty positivity for complement C3. Okay, again I will explain this later. Yeah, right. So let's have a look our normal oral mucosa structure. So where are we now for the pemphigus? Okay, this is the epithelium. The top part is the keratin layer. The below one is the connective tissue with a lot of inflammatory cells. Look at the clefting here. Okay, separation between the epithelium and the connective tissue. There's a specific or a very peculiar pattern of separations. They're not just separate at any locations. Okay, higher power here. They are actually separated at the suprabasal, above the basal region, above the basal cells. Okay, leaving the one layer basal cells below. Right? This is H&E. And another investigation is immunofluorescence, in which the antibody tag with fluorescent light here, they exist in between the cells or in between or at the desmosomes locations. Yeah, so this is a specific pattern for pemphigus, right? So let me explain about the immunofluorescence. There are two types of immunofluorescence, direct and indirect. I focus on direct immunofluorescence. Okay, this picture is meant for pemphigoid, but it is the same. Okay, immunofluorescent concept for pemphigus or pemphigoid is the same. This is the epithelium, connective tissue, and this is the capillary vessels. Capillary vessels containing patients' autoantibodies or the immunoglobulins. Okay, they're being released, and this very specifically attached to the um, epithelium. Okay, depends. So for this pemphigoid, they attach to the basal cells. For the pemphigus, they will attach specifically to the suprabasal region here. Okay, and when we treat the slides with label fluorescent antibody, they will then attach to the autoantibodies, okay, in which they will fluoresce or they will give colors. For example, in this region here, they will give fluorescent light colors at specific locations. So this is the concept, yeah. The fluorescent label antibody attached to the autoantibodies that exist at specific locations at the epithelium, right? So I mentioned to you about the tombstone appearance. What is it actually? Look at the basal cell layer, because this epithelium and connective tissue separations leaving the one layer of basal cells, which looks like tombstone. Okay, not Malay or Muslim tombstone that we have two tombstone for each cemetery. Okay, but look at this tombstone. They are referring to this type of tombstone. Yeah? Imagine the basal cells arranged like these tombstones. Okay, on a very long line here, very linear line. Okay, this line is referring to this histology appearance here. Okay, the basal cell layer. Right. Okay, got it. So keywords for histology for pemphigus, tombstone. I know some of you mentioned tombstone in oral lichen planus. Please do not use tombstone in oral lichen planus. It's misleading actually. Okay, use tombstone appearance in pemphigus only. All right, so we're done with the clinical presentation of pemphigus. We're done with the H&E histological presentation of the pemphigus as well as the immunofluorescence. This is another type of investigation. We call it cytology. They will find you will find Zang cells. What is Zang cells? This is the epithelium actually. Epithelium. The smaller cells are neutrophils. Yeah? Please ignore the small cells. The large cells are the epithelium. They are being separated because of destruction of the desmosome. Okay, or desmoglin 1 and 3. Okay, so they looks like single cells in separations, right? Single cells here, right? And so these are what we call Zang cells. Okay, and treatment is extremely difficult to treat, especially those pemphigus that it has been involved the whole body of the patients, and they use systemic steroids and azathioprine, and a lot of hospitalizations, because the patients are very in pain. This is another presentation of pemphigus. Look at the large ulcers or erosions with mucosal tag here. Okay, and this is the back of the patients with multiple very diffuse painful ulcers and vesicles, right, at the back of the patients. All right, this is the specific locations in which the autoantibodies will attack. Okay, the structures of desmoglin 1 and 3, which occurs mainly at the lower part or suprabasal part of the epithelium. Okay, so this part here, so leaving the tombstone of the basal cells. This is basal lamina. Okay, so in a nutshell, for pemphigus vulgaris, okay, this is to compare pemphigus and pemphigoid. Suprabasal layer again. Okay, tombstone appearance in one single layer of basal cells. They are attacking this region here. so that the epithelium will detach from the connective tissue. This is the epithelium. Okay, is that okay? I hope so. Right, let's move to mucous membrane pemphigoid. So where does the autoantibodies attack? Right. Okay, first of all, it is primarily affecting the mouth, sometimes conjunctiva of the eye, rarely on the vagina and or nasal mucosa. Cicatricial means scarring of the eyes, rarely in oral mucosa. Cicatricial, scarrings, scars, tissue you can find in mucous membrane pemphigoid, or in other term they call it cicatricial pemphigoid. Clinically, bulla can be seen in all areas, especially gingival blistering or dyschromatic gingivitis. Sites commonly seen at the gingiva. Next is buccal mucosa and soft palate. Blisters may be filled with blood or areas prone to trauma. Histologically, epithelial separation at basement membrane, basement membrane below the basal layer, unlike the pemphigus, right? So immunofluorescent linear deposits of IgA or occasionally C3 with or without IgA and IgM. This is very specific, please hafal. Okay. How do we know IgA, IgM, C3? It's actually when we stain the immunofluorescent slides, we have a panel. We have a panel of IgA, IgM, C3. Okay, so we look at which slide that has a positive fluorescent. Okay, by doing that, we categorize, or we can determine the diagnosis of the lesion. And please look into the meaning or the definition of symblepharons and tropion. Okay, this part here, right? Okay, just now I mentioned about mucous membrane pemphigoid cicatricial type. So another type of pemphigoid is bullous pemphigoid. This pemphigoid is a systemic lesion involving mouth, in which the mouth area is rare. Okay, severe skin lesions, only 30% show mild oral lesions, and this rarely subjected to biopsy. Okay, they usually do the biopsy on the skin of the body, okay, instead of the mouth, because only 30% is involve the oral lesions. Another difference between bullous pemphigoid and cicatricial pemphigoid is that limited clinical course of bullous pemphigoid, while progressive clinical course of cicatricial. Okay, most patient of pemphigoid is 60 or 80 years old. Okay, much older patients compared to pemphigus, much younger patients. Between bullous pemphigoid and cicatricial pemphigoid, bullous skin, cicatricial mainly mucous membrane, like the oral, the vagina region, and the eyes. Yeah. Okay, let's have a look at the clinical. Okay, again, the mouth ulcers are basically irregular margin ulcers, no pattern, similar to the pemphigus. This is what we call cicatricial or scarring of the eyes. Okay, these are intact bullous of the body. Okay, histologically, at the basement membrane, very clear, very nice, clean cut here, or clefting. This is the epithelium, this is the connective tissue. So the attack of the autoantibodies is here. All right. And immunofluorescent, very nice at the basement membrane. This is the epithelium. Okay, similarly for the bullous pemphigoid, again, very clear, clean, clear separations between the epithelium and connective tissue. So this is the region of attack of the autoantibodies. Okay, right. Okay, guys, see you in the next slide, in the next video. Okay, so you learn already about the pemphigus and pemphigoid. Please compare them clinically and histologically. Thank you.